Hello and welcome to Nootropics. In this video, I am going to explain bronchial asthma. Before I start today's tutorial, I ask you please to like this video and to subscribe to my channel. So let's start. Bronchial asthma is defined as a chronic inflammatory obstructive disease of the respiratory airways, characterized by increased responsiveness of the tracheobronchial tree to multiple stimuli, which causes recurrent attacks of breathlessness periods and wheezing sounds. Bronchial asthma affects more than 18 million adults and 7 million children in the United States alone, making asthma one of the most common chronic diseases in this country. Actually, there are two types of asthma: atopic or allergic asthma and idiosyncratic asthma or non-allergic asthma. The main difference between them is that allergic asthma occurs with a genetic predisposition, which means the presence of family or personal history of allergy, while non-allergic asthma occurs after infections of the bronchotracheal tree. Allergic asthma is a genetic disease. Its attacks are triggered on exposure to some allergens and irritants such as pollen, house dust, some foods, medicines, allergens from animals, insects, and mites, and also can be triggered by allergens of viruses, bacteria, and pathogenic fungi. A non-allergic asthma is caused by respiratory infections due to viruses such as rhinovirus and adenovirus, and also sometimes by inhaled air pollutants such as sulfur dioxide, ozone, and nitrogen. Both types of asthma can be irritated by the same irritants and allergens. So now let's move to the pathogenesis of allergic asthma. The pathogenesis of allergic asthma is associated with hyperresponsiveness of the tracheobronchial tree to allergens. Patients of allergic asthma are sensitized and a number of immunopathological reactions develops. There are some blood cells participating in the inflammatory response, which are mast cells, eosinophils, lymphocytes, and airway epithelial cells. These cells participate in the inflammatory response by producing inflammatory mediators, which cause edema of the mucosa of the respiratory airways, bronchoconstriction, increased production of mucus, and injury and desquamation of the airways epithelium and impaired mucociliary transport. Edema of the respiratory airways and the excessive amount of mucus produced lead to obstruction of the tracheobronchial tree and development of apnea attack. The clinical picture of allergic asthma includes sudden apnea attack, excretion of sputum from the nose, itching in the throat, in the eyes, and in the skin, with a dry cough. Asthma attacks are manifested in a sudden sensation of lack of air with marked expiratory dyspnea. The inhalation becomes short and the exhalation long. The patient sits in a forced position. Apnea attacks usually end after discharge of viscous mucus sputum from the mouth. I'd like to mention that asthma attacks differ greatly from one patient to another. Some asthmatics can be symptom-free, with mild occasional episodes. Some patients can be found in severe asthma attack, which is called status asthmaticus. Status asthmaticus is characterized by respiratory failure due to obstruction of the respiratory airways, tachypnea up to 40 per minute, and the swollen neck veins. As a result of the respiratory failure, cyanosis is noted. In severe respiratory failure, cerebral hypoxia can occur, which causes loss of consciousness. Blood pressure is decreased, arrhythmic pulse, and muffled cardiac sounds are heard. Objectively and on auscultation, attenuation of the vesicular respiration is noted with the dry whistling rails. And on percussion, bandbox sound is heard and the lower margins of the lungs are lowered, with limited mobility of the pulmonary edge. For the diagnosis of bronchial asthma, clinical symptoms are studied, and also complete blood count is made. In the complete blood count, these signs are detected: leukocytosis, eosinophilia, and raised ASR. In sputum analysis, high amount of eosinophils and the presence of Kirschmann's spirals and Charcot-Leyden crystals. In spirography test, reduced maximal ventilation rate and reduced Tiffany's index. In the chest X-ray, increased transparency of the airways is detected and lowered inferior margins of the lungs. And the skin allergic test is positive. For the treatment of bronchial asthma, there are etiological therapy and pathogenetic therapy. The etiological therapy includes stopping the exposure to allergens and irritants, and the pathogenetic therapy includes the administration of corticosteroids, bronchodilators, mucolytics, and expectorants, and also stabilizers of mast cells membranes are administered. This is all what I got for today's tutorial. Please like this video and subscribe to my channel for more videos about medicine. Thank you and see you on next videos.